So the history, the concept of hyperbaric chamber is actually quite old. According to some historical records and data, the original concept was actually in 1662. Until 1900s, people really did not know what benefit they were getting from it by pressurizing people in air, and also there were no scientific data for it. In 1917 in Germany, two physicians actually for the first time pressurized people with oxygen to treat decompression sickness. So in US, the first chamber was built in New York. There was a neurologist who noticed that during the construction of Hudson Tunnel, when people were coming up after working in deep sea, they were getting very sick, they were getting muscle weakness, they were getting paralysis, they were getting seizures. So he started treating them under pressure with hyperbaric chamber, but he was also trying to treat them for different neurological illnesses, most of which did not work except for decompression illness. So in the last about 50 years, a lot of experience has been obtained and some research has been done to prove the benefits of pressurizing people under oxygen. So what is hyperbaric? Hyper means anything over, and baric is barometric pressure. So when we pressurize people in a chamber with 100% oxygen, the availability of oxygen increases. Typically, when we breathe, the oxygen is carried to the tissues just by red blood cells. When we pressurize them, so at sea level it is 1 atmospheric pressure, so if we pressurize people to say 2.5 atmospheric pressure, oxygen is also dissolved in the blood and in the body fluids, and which increases exponentially the amount of oxygen that can be delivered to the damaged tissue. And this really helps in the healing process. Over the last several years, studies have been done that show that oxygen increases the infection fighting ability of white blood cells. It also helps in the formation of new blood vessels. So when we are treating diabetic ulcers, one of the problems is they are not getting enough blood. So when we pressurize oxygen, it increases the quantity of oxygen reaching the diabetic ulcer, and it ultimately helps it heal. The other treatments are carbon monoxide poisoning, people who have radiation burns from cancer, especially head and neck cancer. High doses of radiation can cause skin and bone burns, which can destabilize the jaw, and this is one of the treatments for that. And there are some other treatments which are done with hyperbaric chamber. So typically what we do is we have to evaluate a person to make sure they can withstand the about 2 hours of treatment. It's somewhat like you are flying when the pressure is increasing. It can cause pressure in the inner ears, so people have to be able to equalize the pressure in the inner ear with moving their jaws. If there is a problem with that, then we can have an ENT look at it. People, you know, it's a closed chamber, though it's glass, people can see. Outside we have a TV so they can get entertained, but it's still, it can be claustrophobic because you are closed in a chamber. So that is something we have to talk about and sometimes use a medication to help them calm down. If we look at the data, one of the, actually the second most common cause of the reason why people lose their feet or their legs, the most common cause of, second most common cause after trauma for amputation is diabetic ulcers. And it's a very common story that it starts with a small blister, progresses into an ulcer which doesn't heal, it gets deeper, it gets to the bone, And by that time, it becomes an uphill battle, and a lot of time people end up losing their feet or their legs. So hyperbaric chamber can really, if started in time, it can really help save the limbs and affect people's quality of life. So that's very important. It's called an adjunct therapy. So first, we do the dressings, we make sure there is infection is under control, and after everything that we add hyperbaric treatment to the treatment. I'm affiliated with Newton Wellesley Hospital, and I've been running the wound clinic here for about 12 years. And we've seen hundreds of, or probably thousands of people here. We started out originally in Waltham, and then we moved to Wellesley in 2007. We needed a bigger place to put the chamber in, so we just moved to Route 9 here. So what happens is when we are getting older, the skin becomes thinner and weaker, so it breaks very easily. And I hear all the time, sometimes people say that they were at the restaurant or somewhere and they hit the leg or scraped the leg against something and they did not feel anything, and they were wearing clothes like sweatpants or jeans or something. And the only time they realized something is wrong when they felt some wetness in their feet. And that's because the blood was draining down to the feet. That's when they felt it. So it's very common because the skin is so weak, it breaks easily. There is a lot of dryness also as we grow older, which also makes the skin weaker. So we always recommend using some good quality a moisturizing lotion or Vaseline or something like that. So we see a lot of trauma wounds, we see a lot of diabetic ulcers, we see a lot of what we call venous ulcers. People have poor circulation in the leg. So what happens is because of the circulation, there is swelling in the legs. The swelling stretches and weakens the skin, it breaks down, it starts to drain. Very common story, it started as a blister and it gets bigger and it's been draining. So there are particular ways of treating it. And we see quite a few of those. Problem is, if they don't get treated properly and in time, they can get infected and people end up in the hospitals. We see all sorts of other unusual cancers. One of the things I often see is like typically somebody would come with a story that I have this small scab on the leg, it gets dry, it gets a scab, the scab falls off, the wound starts again. So I have seen so many, I always ask them, did you grow up on South Shore or North Shore? Because in old days, people would go to the ocean, they would have baby oil or some sort of oil, and they burn the skin. And over the years, that converts into skin cancers. And that's a very typical story, that a skin cancer can show like a small ulcer which just doesn't heal. So, after seeing so many at this point, when I hear that story, I just do a biopsy, and if it turns out to be cancer, send them to a skin surgeon to have it taken out. So typically at the sea level, we are at 1 atmospheric pressure. And for the hyperbaric chamber to be effective and have enough oxygen going to the healing tissue, we need to pressurize it at least above 1.5 atmospheric pressure. The typical is about 2 to 2.5 atmospheric pressure for most of the diabetic ulcers or other things that we treat. So right now it's at 1 atmospheric pressure, and we have 1.5 to 2.5, and 3 is the maximum. So we move this knob, and that will bring this needle to the desired pressure. So as this air starts to come in and the oxygen starts to come in and pressurize it, then this meter will show the actual pressure inside the chamber. And it takes about 15 minutes to pressurize to the desired pressure, say 2 atmospheric pressure. And this thing is this knob shows the rate of pressurization, so we can pressurize it faster or slower, depending on how much a person tolerates. So typically we do it's at number 2. Then we have a ventilation control, because one person is inside and breathing oxygen, they can feel a little bit warmed, so we can have the air circulation inside. We have, this is an exhaust button, it's for emergency exhaust in case something happens to the person. We have the timer to clock everything. So once the person is pressurized to whatever desired pressure is, say 2 atmospheric pressure, about 15 minutes, then the actual treatment has to be at least 90 minutes to 2 hours. And that's the minimum time that's necessary for the beneficial effect of oxygen under pressure to show the difference and do the healing. And this is for communication, so if a person is in, we can talk to them. There is entertainment system, they can hear the TV. It also has a video, they can watch the programs. So overall, it's a very simple, straightforward system. There is not much very complicated. In there is a mask that sometimes we use as air brake. So if somebody is breathing oxygen for a prolonged period of time, some people are sensitive and they can have side effects like a seizure type activity or something. To prevent that, if we have to do it for more than an hour and a half, then halfway through we have them put the mask on and just breathe normal air. So that gives it a little bit of a break from oxygen.
6 months ago I started having my right foot, all the toes were amputated off my right foot because of diabetes. And because of the diabetes, they also had to amputate the toes on my left foot. But then a problem arose and they had to amputate almost half of the left foot. That was a little over 3 months ago. And at the time, the wound was not healing at all. And they gave me less than a 50% chance of saving my leg. My surgeon said my only chance of saving the leg was perhaps to see Dr. Faruqi. I came to him 3 weeks ago. And 3 weeks ago when I came in, I figured I had no chance to save my leg. And in the past 3 weeks, what this man has done, this doctor has done, has been absolutely miraculous. I believe that I not only will save the leg, but I also believe that I'll walk again, which I never ever expected after the amputation of my left foot. You almost feel like you're in a space capsule when they put you in. You hear the clunking of the cover closing, and then you're in there for like 2 hours. And I try to think of going to different planets, outer space. Doc always asks me when I come back, how was my trip? But it's, I tell you, it's nothing less than a miracle, truly. Occasionally get pain, but that's what Doc told me was like phantom pain. When you have something amputated, you feel like, but nothing severe, nothing serious, anything like it was prior to the amputation. I used to get terrible pain when I had my both feet, and that was due to the neuropathy, I guess. And but now it's not, and I look forward to recovering and walking again.
So right now we are checking the blood sugar to make sure the blood sugar level is at least above 110. So this is a process we want to make sure there is no static so that it's not going to spark anything. And this is a ground tube. It grounds the person, but before that we want to check the static. So that's good.
Good. Are you ready?
Put on 15.
I gotcha.
See you when I get back.
Wait a minute. It says our lead purchase stuffed animals for both victims that have appeared at RV.
Okay, so this will gradually build up the pressure, and Tara just set up the time, and basically now we'll just watch how it goes.